about dermatology and what is dermatology and what is a dermatologist do, uh, everything about dermatology. We won't enter into the diseases, but we just talk about what is dermatology in general. Dermatology is a branch of medicine concerned with anything related to the skin, the diagnosis and treatment of skin diseases. A dermatologist is a doctor who specializes in conditions involving the skin, hair, and nails. He can identify and treat more than 3,000 conditions, including eczema, psoriasis, and skin cancer, and many others. Skin is your first line of defense against diseases, protects your other organs, warms you up, and cools you down. Dermatologists have intensive training, going to school for 12 years or more to learn to diagnose and treat more than 3,000 diseases of the skin, hair, and nails. You might see dermatologists treat a baby's prominent birthmark that threatens the child's eyesight, remove a mother's deadly melanoma at its earliest, most treatable stage, offer relief for a student whose chronic eczema makes sleep nearly impossible, diagnose the life-threatening liver condition causing a grandfather's unbearable itching, treat the hair loss of a young woman, helping her gain the confidence to complete a job search. So, becoming a dermatologist requires many years of education and training. We need 4 years of college, earning a bachelor's degree, 1 year of internship, 4 years of medical school, becoming a medical doctor or doctor. So, a total of 8 years, and a dermatologist residency program. So, it's 11 years. How did the dermatologist become board certified? You need to graduate medical school, finish an internship at a dermatology residency program, complete 12,000 to 6,000 patient care hours, obtain a license to practice medicine, and pass the exams given by the American Board of Dermatology, the American Osteopathic Board of Dermatology, or the Royal College of Physicians and Surgeons of Canada.
Okay, why should you choose a board-certified dermatologist? Dermatologists treat more than 3,000 conditions that affect the skin, hair, and nails. Skin diseases are especially common, affecting 1 in 4 Americans. So, dermatologists have a big role, especially in America's. Dermatologists treat a wide variety of skin conditions, from deadly skin cancer to warts. Issues dermatologists see may include chronic Disney disease caused by problem with your immune system, allergic reaction to everyday substances, infections caused by viruses. Dermatologists also help patients who want help with cosmetic concerns, including issues with their aging skin. Treating wounds caused by surgery to remove a skin cancer. So basically, there's a lot of important dangerous diseases and conditions that dermatologists have to deal with. That's why dermatologists are really important in society. Let's say for will help you in fixing it. Next slide. Okay. Specialties within dermatology. Let's say you enter dermatology, and then you want to specialize in a specific thing. There's 3 main paths for dermatologists. The first dermato. This is a combination of dermatology and pathology. Pathology is basically the study of certain diseases. So it's more lab work than working with patients. Mohs surgery. This has to do with skin cancer. And pediatric dermatology. Pediatric means it deals with children more than anything. And I'll talk about this now in more details. Next slide. Okay, a dermatopathologist. A, der- a dermat the a dermat. Alright, I'm just gonna say it once. A doctor who specializes in both dermatology and pathology. When your dermatologist sees an issue of concern, they might biopsy it, removing a piece of skin, sending it to a dermatopathologist. That is right this time, to confirm their suspected diagnosis. So it's this dermatopathologist is it deals with like certain diseases, and it has more information on the disease itself. A dermatologist may just diagnose the disease. So there's a difference. Um, he examines the biopsied skin with a microscope and provides your dermatologist with a written report called biopsy or pathology report. All right. So they gave us an example. Let's say you have a certain problem with the skin. You have a huge wart, and so what happens is your dermatologist will diagnose it, see what it is, and then he will send it to the dermatopathologist. And as I said before, dermatopathologists, they're more specified in lab work rather than working with patients. They don't diagnose; they just do research on specific things. So if they see the sample, they give details about this, how to deal with it, um, how long will it last, and so on and so forth. They just give a lot of information, and then your dermatologist will deal with the patient and tell him what to do. Um, this vertical disease found including stage severity, okay, possible treatment for some conditions like skin cancer, an examination by a dermatologist. Yeah, there's another specialist for skin cancer, which is, as I'm going to talk about, the Mohs dermatology, Mohs surgery specialty, and he's the one that um, deals with cancer straight away. In this case, the dermatologist, um, he's going to just diagnose. He's going to say how severe it is. He can't do a lot of things with skin cancer. Next slide. Why choose a board certified dermatologist? Board certified dermatologists first complete training in dermatology or sometimes in pathology, and then dedicate another year of training to develop advanced skills in diagnosing disease on examination of skin samples under microscope. Um, Basically, what they do is, as I said, dermatologist is a combination of dermatology and pathology. Pathology is, if I'm not mistaken, um, the study of diseases in general, like lab work. Dermatology is the skin. So you combine the two, you get the development of skin diseases in the lab or something like that. I'm not sure exactly. Um, so they either begin in dermatology or pathology, and then after their study, um, they take another few years to have advanced skills to be both of the to be a dermatopathologist. Mouthful. They must pass another exam in dermatopathology to become board certified. If you have any concerns about their diagnosis, you can ask to have a board certified dermatologist to read your sample. So yeah, self-explanatory. Right, next slide. Okay, a Mohs surgeon. This has to do with skin cancer, as I said. Um, a Mohs surgeon is a dermatologist who performs a special technique called Mohs surgery to treat skin cancer. I think we all know what cancer is, as we've learned in biology. But just to recap, cancer is when you have uncontrollable uh, cell growth, or like there's a lot. The cell reproduces way too much, and it goes,
Mutation in the
yeah,
cells.
mutation in the cells. Thank you, Yusuf. Involves removing thin pieces of skin and then examining each section with a microscope. This examination helps the dermatologist to ensure that they are removing all the cancer cells. It can also minimize the removal of healthy skin as the surgeon stops when they no longer see cancer cells under the microscope. So they do the surgery, basically, and they remove all the cancer cells that won't stop growing. Mohs surgery has many advantages, but it's not the right treatment for everyone who has skin cancer. So, um, not the same thing applies to everyone. A dermatologist considers many factors before determining which treatment will be best for each patient. These factors include the type of skin cancer, whether the cancer has spread, and where the cancer appears on the body. So if cancer is in a sensitive area, they might decide not to perform surgery, as maybe it will have a lot of side effects. Um, another factor is whether the cancer has spread. How much, how severe is the cancer? How much has been grown? And the faster you seek medical attention, the the less severe and less spread.
Yeah,
So
because there's like stage 1, 2, 3, and 5 of
yeah,
cancer, right?
if you get at a lower stage, there it is less severe. And maybe if it's if it's on a high stage and it's widely spread, um, maybe it's not controllable, as it may get in the blood, the heart, so it could be dangerous.
Yeah, it can
Uh,
spread, true.
yeah, and uh, also the type of skin cancer. Maybe some skin cancers are not as treatable as others. Next slide. Okay, why choose a board certified Mohs surgeon? What does this Mohs surgeon have to do in order to qualify to be a surgeon? And I mean, a surgeon really can change a person's life for the better or worse. So he needs specific qualifications. Um, After completing dermatology residency, which is the last stage, as Rayan said on his slide, the dermatology residency takes at least 3 years. A Mohs surgeon completes additional training, including a formal fellowship. He needs extra training because at the end of the day, surgery can end a person's life. So if he's not trained properly, lives will go away. Um, this training typically takes 1 year and focuses on Mohs surgery and surgical reconstruction. While all dermatologists learn about Mohs surgery during their training, a Mohs surgeon receives the most training. So he's the specialist that, like, yeah, especially he just specializes it. Others know about it, they know everything about it, but this guy is a specialist. He knows everything that needs to be known. Next up, a pediatric dermatologist um, deals with kids. Basically, it's dermatology for kids, treating children, including infants. There may be a lot of um, infants that are born with a skin disorder. So a pediatric um, dermatologist is the one that deals with him specifically. If the child has a condition that affects the skin, hair, or nails, you may consider treatment from a pediatric dermatologist. Um, some diseases that affect the skin, hair, or nails are more common in children, and some diseases can only occur in children. So there's some skin disorders and skin conditions that are not um, that do not happen to adults; they only happen to children. However, you may be referred to a pediatric dermatologist if the child is diagnosed with a severe problem, challenging birthmark, or rare condition. For example,
Okay, here's the end of the presentation. Thanks for your attention.